Hello, everyone. Today, I'd like to share with you some of my thoughts related to a checklist that the Centers for Disease Control and Prevention put out on their website that is related to what parents need to consider before sending their child back to school for in person instruction. Take a listen. All right. So here's the checklist planning for in-person classes. Now this is available on the CDC web site to for parents can print them out and to use this checklist to see whether or not they are following the recommendations that they've presented. Now after looking it over, one of my quick impressions is that it tells us things that we've already heard, but it's placed in a nice single package for parents can use to help determine whether or not they're following protocols. You're looking at the beginning. The beginning is checking for signs of illnesses. As you can see, that there's 3 points, and we all tend to have a good idea of what the illness's symptoms are and what to do about it when somebody is exposed. Now here, we see that check with your child each morning, make sure the child does not have a sore throat and yada, yada, yada. If your child has close contact with a COVID-19 case, they should not go to school. It's important to say that specifically because adults and parents alike are going to send their kids to school because of, well, it's logistically difficult for the child to stay home when the parents have to go work, and to find somebody to take care of the child at that time if there are 1 or 2 symptoms that present itself. So I don't have a lot of confidence that this is going to be as strictly followed. It says follow guidance on what to do when someone has a known exposure. Well, yes, that is fairly easy to follow, but is it going to be followed? After having a conversation about this particular issue with parents and my colleagues alike, we've come to the unfortunate conclusion is that we cannot keep that particular part at 0%. So, in other words, not all parents are going to abide by that particular rule. So I'm wondering, in a school of 350 or a school of 1,350, if that percentage goes to 5% of kids that have had that kind of exposure, then we're going to see propagation of that virus across the groups. The next point is identify your school point persons to contact if your child gets sick. This gives us the idea that schools or the district in general will have someone to contact specifically. It's important to have somebody to contact, and when a child cannot come to school, you call the registrar's office. You let them know that Johnny isn't coming to school that day because of COVID. Many times you're not certain whether or not the child has COVID, but you can say the child is showing these symptoms and is going to get tested, which leaves it up to the school to make a follow-up check to see whether or not the child had tested positive in order to do what the CDC outlines in another part of the website to deal with COVID in schools. The next point, be familiar with testing sites in the event that your child develops symptoms. In our area, in the Rio Grande Valley, we've had a fluctuation in the types of testing, the places where testing is available, and the length of time it takes to get tested. So if the child had been exposed and needs to get tested, there might be a 3-day lag before the results are turned into the parent. So the next point is make sure your child is up to date with all recommended vaccines. That's a good idea because as it mentions here is that especially with the flu virus, that in the coming months we're going to have an uptick in flu cases, and the combination of COVID and flu virus working its way through the school is not a desirable condition. But again, I go back to my initial point. while they have the vaccine, while they will be tested against the flu virus, there's going to be confusion and anxiety as whether or not the symptoms the child is experiencing are flu related or they're related to some of the more esoteric or obscure symptoms of COVID, especially with children under the age of 10. We don't know how that's going to be managed. We haven't received any information, at least from the CDC. So it's leaving it up to the schools, and we're leaving it up to folks who are educated in pedagogy, but not in biology. While there might be some people on campus that do have a background and a strong background in biology, master's degree, and may provide some guidance to the school district, but I don't think that will be as prevalent and widespread as possible. But then again, that's just my opinion. So the next point is to review and practice proper hand washing techniques at home, especially before and after eating, sneezing, coughing, adjusting face cover. This is a good suggestion, especially with younger kids. You want to instill the idea that you are giving them the best opportunities to keep themselves safe. Unfortunately, here are some of the caveats. Children are going to be impulsive and forgetful. It's going to take a little while before those particular behaviors are adequately shown and the kids have adequately learned them. We're in the summer, and many of those behaviors are not reinforced during the summer. And unless the parent is right now in late July is actively trying to adopt those behaviors, then you're going to see that kind of behavioral expression inconsistently expressed. And another problem I have with this is that, you're making hand washing fun, as it says, and explain to your child why it's important. But simply because the child knows it's important doesn't necessarily mean the child will act on it. And these are for kids. These are for kids under the age of 10, which supposedly has a very small rate of infection and supposedly a very small rate of transmission. But what about adolescents? Many times, most of the adolescents are not going to follow these kinds of recommendations, and who's going to enforce it? And my last point on that particular area is this is an airborne virus. This is spread primarily through exposure to viruses, and a more recent study that indicated that with masks, you're able to filter out the majority of the viruses, and if you do catch COVID, then it's only going to be in smaller, less intense amounts, which is going to improve the opportunity to battle the virus successfully. Now the next point. It says, be familiar with how your school will make water available during the day. Consider packing a water bottle. Schools are going to ban the use of water fountains. So it's going to be left up to the kid to bring water to school. Yes, you have your water mills where you can get a gallon for 25 cents and use that and transfer it to a plastic bottle and have the child carry it. This is going to be a lower or limited expense. And bottles of water are not as expensive to me, but buying bottled water frequently for families that are struggling with a paycheck at this particular juncture in this pandemic, in this first wave of the pandemic, we're not going to see as we're not going to see parents do it as religiously. It's not something that is considered very important. The next area is develop daily routines before and after school. For example, things to pack in school in the morning, things to do when you return home. And it's important to develop and establish daily routines. I'm saying develop daily routines. To establish a daily routine, you need a minimum of 28 days. And that's just on a common sense approach to establishing a routine. Some of the psychological data would suggest that 60 to 65 days is an appropriate amount of time to establish a routine. And when establishing a routine, if you miss 2 days in a row, you're going to break that routine during the course of establishing that routine. So CDC says develop. I say develop and enforce daily routines. Enact. Make it embed in the child's brain. Because, yeah, it's important whenever they do come home, washing their hands, their faces as well, which is not included here, and taking off their clothes and putting it in a washer. Now, here is one of the points where it's difficult to follow. Because wanting them to put it into the washer or put it into the washing or to the clothes bin, except not everybody has a washer and dryer at home. And keeping it in the clothes bin may or may not be something that's going to be done effectively and daily. Next point. Talk to your child about precautions to take at school. Children may be advised to wash and sanitize their hands more often, keep physical distance from other students, wear a cloth face covering, avoid sharing objects with other students, use hand sanitizer. So the only part here that lends itself to what is the real problem, as in an aerosol or aerial transmission of the virus, is wear a cloth face covering. The other ones, in my opinion, the other areas are helpful, but not as helpful as just wearing a face covering, a cloth face covering over the nose and the mouth. So when using hand sanitizers, this could be a substitute for washing your hands, but also saying if they have the funds, they can carry it. I know we do. But also keeping physical distance from other students. This again, when you develop and establish that routine, it's establishing what the physical distance that you need to keep in order to keep yourself safe. So develop a plan as family to protect household members who are increased risk for severe illness. Now, speaking for the more economically disadvantaged families that may have Spanish as a primary language in the home, when there's multiple generations that might be living in the home, this particular part of the recommendations I see as probably one of the most difficult to establish. So you're asking them to develop a plan. There might be multiple family members who have obesity, type 2 diabetes, hypothyroidism, hypertension, high cholesterol, and limited activity and exposure to sunlight. So they might have low vitamin D3 levels. How to determine to keep them safe is a plan that is that I think requires greater interventions from the school district where the child is going to attend. Well, I do have a plan, a template that I do provide to some parents that I work with, and this will be something that I will review sometime in the near future. But developing the plan and establishing the plan are two different things. Going back to the same point, 65 days of daily implementation of the plan and not take more than 2 days off from enacting the plan. Next point, make sure your information is current to school with emergency contacts, individuals authorized to pick up your children. Well, this should be done at the beginning of every year, and it should be done with an added layer. And the added layer is there going to be somebody, a secondary source or secondary person who can step in for the parent if unable to pick up the child, with the likelihood that somebody in the school is going to have contracted COVID-19. Next is be familiar with your school's plan of how they will communicate with families when a positive case or exposure to someone with COVID-19 is identified and ensure student privacy is upheld. Well, the school is, I would gather they already have it up in their website, or they're putting it into motion to have it complete before September 27th, which is the tentative date that the local school districts are using to demark the first day of school in person. And in the next 2 months, I'm sure they'll be able to come up with something that will be able to communicate with families what they're going to do. And what the CDC suggests is that schools close down for several days, 3 to 5 days, in order to disinfect the entire school. Again, I go back to my own. It doesn't seem likely, where you have 350 kids in an elementary school, and there is multiple layers of contact and an undetermined amount of time that the child can have COVID and continuously spread it to other kids. So how are they going to find out that the child has COVID? By exposure to a parent or to an uncle or to an older sibling who is showing symptoms? We don't know that yet. Plan for possible school closures or periods of quarantine. Yes, now this is an important aspect of this in-person checklist, because for possible school closures, I like their confidence, but there, especially here in the RGV in Rio Grande Valley, there is going to be some school closures. There's going to be periods of quarantine. I just spoke to somebody about somebody who works at one of the local hospitals, and he says is that their COVID unit is overwhelmed, and the nurses are having a very hard time with the emotional adjustment to the loss of patients and the losses of patients who are there by themselves. So we're having this kind of communicable disease, illness is continuously and spreading across our community. If transmission is increasing in your community, or if multiple children or staff test positive, multiple tests, the school building might close. And that's contrary to what has been said in another part of the website, where it says whenever there is one or more, then the school will close. So this is giving school districts that undetermined amount of exposure to positive cases, where they can determine whether it's high enough for school closures. So does that mean that if one kid contracts COVID in the school of 350, that would the school will get closed down because it's going to be about a 0.03%, or is it going to be 5 kids in a school of 1,000 that will merit closing? Because the proportions are going to be different. We don't know. But nevertheless, planning for school closures means that the parent is going to have a secondary support system. And as we know, a lot of the families in the area are it's a dual income household, and they do not have the kind of supports that are needed. So if somebody does come down with COVID and the parents need to go to work, if they do have a job, and so the grandparent is more than likely going to be taking care of the child, and we don't know whether the child has been exposed and will transmit that virus to the grandparent. We don't know, but the CDC doesn't mention that. It says make a plan. So I would suggest that do not plan the child to stay with somebody over the age of 50. Just don't plan on that. And planning for transportation, if the child's riding the bus, or is the child riding in a carpool, to use face coverings. So if you're riding on the bus, they're talking about rules of spacing, which right now a 5A school is going to have a budget of $1 million to transport kids by bus. So if you're going to have the spaces that you require, you're going to have to double the number of buses, because instead of having 4 per row, you're going to have 2 per row. It's jaggedly spaced. So you're going to have an increase in the amount of expenses and gasoline, and you're going to need more buses. Or if you're going to have a staggered dismissal period, then all the bus drivers are going to be continuously exposed at different rates to the number of kids. So that seems like a nightmare. But Schools are supposed to figure this out. And if carpooling, then the child is going to be sitting right next to the other kids in the carpool, and regardless of face masks, there's going to be some exposure. But although it's going to be about 0.5% of contracting if there's 6 feet apart, but an estimated 0.5%. Well, next is talking about the IEP and working with your schools and trying to find and figure out tutoring or after-school support for specialized services. You'll need to discuss with the special education department about what plans they have for providing these services. Since it's part of the IEP and it's in special education programming, it is required if there is in-person education. So the cohort model, that depends on the school. And reinforce the concept of physical distancing with your child. Physical distancing has been discussed for the past 5 months, and physical distancing is an action that we have to cognitively be aware of, because we are naturally predisposed to wanting to be more social, so to get closer, talk with each other more. So now ask your school to plan to endure students the following practices, reduce spread of, okay. So here, ask how your school plans to help ensure that students are following practices. So we have been trying, me and a colleague of mine, we participate in providing school districts workshops, and we provide workshops on positive behavioral supports. And part of this involves the relationships between teacher and student. And also part of it is monitoring, that is just staying out in the halls and interacting with kids in order to minimize the amount of disciplinary problems that could surface when they're left unattended in the school. So there has to be a plan other than positive behavioral supports that can help ensure that the large percentage of kids who are not following the plan will follow the plan. This is setting up some altercations and confrontations. I'm interested to see how schools are going to manage it. So this next section on cloth face coverings. Encouraging if your school is requiring or encouraging cloth face coverings. Now, CDC is not, in that language, is not suggesting strongly that kids need to have face coverings, and it doesn't seem to recognize the danger to a number of teachers, especially the more tenured ones, who are more susceptible to the illness. But if your school is requiring or encouraging face coverings, by all means, why not? So actions to take and points to consider. So if it's snugly, cover your nose and mouth, secure ties. These should have been practiced with your child for the last few months. So label your child's face cloth. I like this one. Label your child's cloth face coverings clearly in a permanent marker, so then the child can know that it's his or hers. Practice with your child putting on and taking off the cloth face coverings, without touching the cloth. Again, when you practice an instruction, you want a lack of distractions that's going to interfere with your child enacting this behavior regularly and consistently. That needs to start happening right now. You need those 60 days to ensure that it's a routine. Okay, explain the importance of wearing a cloth face covering, and how it protects other people from getting sick, and to a smaller degree, how you're going to be protected from getting sick. Consider talking to your child about how other people who may not be able to wear cloth face coverings for medical reasons. It says asthma, but I'm not familiar with any specific reason to not wear a face covering, whether it is a medical face covering or a cloth one. Well, asthma can be exacerbated by it, but there are many medical personnel who continuously for hours wear one and without any disruption to their oxygen levels in the blood. As a family, model wearing face coverings. Now, here's an important part because the kids are going to learn through modeling and instruction, and then always keeping it on regardless of where you're at outside. But this is not often enacted because people go visit friends, they take it off. They go visit other family members and take it off. So there seems to be a lax leeway about why and when it should be done. If you have your young child, help build their comfort wearing a face covering and become comfortable seeing others with face covers. So this goes with the 4 and 5-year-old before they go in. And the 4 and 5-year-old is going to have a great time. Practicing if either parent works with him or her just in a fun and carefree way. But always emphasizing the face cover. And I like this. Put a cloth face covering on a stuffed animal so that you can highlight and emulate it. So be inventive, be creative. That's what I suggest to parents. And last, consider providing your child with a container to bring to schools to store their face covering whenever they're not wearing it, such as when they're eating. So this is to help prevent the child from putting his or her fingers on the front part of it, it can be inhaled and cause some problems. Mental and social emotional well-being considerations. Now this is really knocking on my neck of the woods, or it's really knocking in my area. So mental and social emotional well-being considerations. So first, talk to your child how school will look different. Good, it's preparing the child about things are not going to look the same, especially if they're moving from 4th to 5th grade and they're still in the same school. They'll see some major changes. Children that are moving from 5th to 6th, being middle school, will not have as much of a drastic change in how it's going to look because they're already going to be experiencing changes in class and block schedules or whatever they do in middle school. So talk with your child how school is going and about interactions with classmates and teachers. Find out how they're feeling and communicate with them. So yes, talk to your child. You hear this, and any mental health specialist is saying talk to your child so they can label their emotions and express it. And here's the important part. The parent eats it up and does not respond or react negatively, just responds confidently. This is the time when you are supposed to show that kind of confidence to your child. So anticipate behavior changes in your child. Now, this is an important consideration because there will be behavior changes. What it's not saying is that how the stress and anxiety is going to grow slowly, and by the time you're starting to see it, that may be like 4 or 5 days after the effect of whatever is stressing your child out. And you don't want to go over 2 weeks, because 2 weeks is going to be the kind of like that Goldilocks zone where you can come back from it. But if you continue on, it may start to establish itself in the psyche and cause further problems. So try to nip it at the bud. That's what I'm saying. Try to attend school activities and meetings. Of course, you'll hopefully do it by Zoom because they're not going to further attempt to expose parents. And if it can be done through Zoom or by telephone, that's the preferable way. Here it's saying attend those meetings. Schools may offer more of these virtually, as it says. So ask your school about plans to reduce potential stigma related to having or being suspected for having COVID. This is an area that can be further discussed with the local health officials and putting a plan together with them. And hopefully school districts are putting this into play. Check if your school has any systems in place to identify and provide mental health services to students in need of support. If so, identify a point of contact of these services at your school. Most school districts have some licensed specialists in school psychology that are working on staff, and who can serve to assist counselors into providing some support. Some school districts that are more progressive and inventive have also trained teachers to conduct restorative practices circles. And these circles can also be used to help voice uncomfortable emotions in a group. Of course, everybody will be wearing a mask, and that's going to be discussed. But that would be one way to use training and have an emotional support system available in the schools that doesn't necessarily need to rely on the counselors or the licensed professionals. So check if your school has a plan to help students adjust to being back in school. School students might need help adjusting to COVID being disrupted their daily lives. And again, this is counseling and psychological services, social emotional learning, these kinds of programs, peer social support groups if they're available. And here in the Rio Grande Valley, they are not necessarily widespread, although some school districts do adopt them. But nevertheless, there's still a dearth of mental health services in school districts for a number of different reasons. Check if your school will provide training for students in mindfulness incorporating SEL. Now, hopefully they can because, well, I am a trainer in social emotional learning and in mindfulness. But it's a matter of just reaching out and finding people like me who can provide these kinds of services on a larger basis. And role modeling, practicing self-care. I do have a video on self-care that's available through my YouTube site on Mid-Valley Behavioral Health and Psychological Services. And it's an hour long and it covers a number of different areas for parents. And I can make it available. Right now it's only available to people, to specific school districts. But I can make it available to the general population if they're interested. All right, well, thank you for paying attention. This is my review and some of the complications with this kind of plan. Hopefully you enjoyed this. Give me a like if you can, and I will be recording every week on something that's enjoyable to or important and valuable to our community in general. Thank you. Well, that's it for today. I'm going to share some more of my thoughts related to the CDC's suggestions and recommendations for this coming school year on some upcoming videos. I will be releasing videos every 2 to 3 days on my YouTube channel, Mid-Valley Behavioral Health and Psychological Services. Please subscribe if you like the content. And if you're interested in some more things that we put out, come to our website. It's www.midvalleybhps.com. Or you can look for me on Instagram. I'm vpuente at Instagram. So hopefully this information was helpful. And please stay safe.